So the grant means to us as a critical access hospital, we're obviously a little strapped on resources or funds a lot of times. So having this extra funds gives us opportunity to improve the programs and different programs for our patients and our community in the hospital. So there's a few different areas that we're focusing on with this grant. One of them is quality, which obviously patients really won't see that, but hopefully, we want to provide the best quality to the best standards of care that we can do for our patients. So hopefully, they're getting the best of care that they receive. And then another focus was infection and antibiotic stewardship. So we want to make sure that they're getting the right antibiotics for what they're being treated for. In the past, there were times that they were just, given 2 or 3 different antibiotics, hoping that one of them would work. With this, now we can really focus on what they do have and what can we treat it with. This is the only hospital here in Cheyenne County. We have 2 clinics that we also operate. One of them is in Bird City, which is 15 miles down the road. It's a huge resource, and we want to keep our hospital here for all of the patients. And we don't just serve those that live in Cheyenne County. We serve others in surrounding areas as well. So we want to have the best care, have providers here for years beyond when I'm here. So yeah, it's very important, very vital to a community, especially in Northwest Kansas. Kind of a school and a hospital are your important things to keep the livelihood of a community going. So that's our goal here. It's very important, especially with you having either like a heart attack or a stroke. The minutes to get to where you can get care is critical. So out here in Northwest Kansas, 30 miles is about where you can get to the next hospital. So if we weren't here, you're talking 60 miles or farther. So keeping all these facilities in in any rural area, not just Northwest Kansas, but the rural areas is highly critical for patient care and patient outcomes for sure. So I think we're very fortunate to have families like the Patterson family that puts out grants and different opportunities for especially critical access hospitals to use towards our patients, our community, and our facility. We're just very lucky to have those type of resources that cater to us, I guess, in a way. I would tell them thank you very much of how important it is. Hopefully they understand how important it is to us in a small facility and how these resources are really used, and really want to focus them on having better outcomes for our patients and having the best facility for our community. So yeah, a huge thank you. Much appreciated.
I would like to tell them thank you for providing the funding so that we can have this grant for rural communities. Resources and funding for rural communities is something that's very beneficial to the communities. So thank you. I would say the biggest change that the patients and families would see would be developing process improvement. And as far as our antimicrobial stewardship program, we have a pretty robust one already. And so just helping with those final details to maybe make those tweaks to make it just a little bit more successful would give the best care to the patients. I think just having a resource to go to whenever, they're always very willing to help. And that is big because in a small facility, sometimes you don't have a lot of people to go to ask those questions. And so just knowing that you have the opportunity to bounce ideas or bounce processes or bounce policies, they will help find those resources as well for us and then get those to us. And so just having that is huge. We have been recently working with Julie and Karen with the Care Collaborative with this Patterson grant. We recently were signed in on this grant, so we're kind of in the early stages of it at this time, but so far we've met with Karen to help prepare for survey readiness and making sure that we have the check boxes marked for that. She's helped with some policy development. She's worked with our pharmacist and infection prevention nurse as well, and just reviewing those policies and procedures for those things. And then we have been working with Julie as far as the QAPI program goes, and she's helped with developing policies as well. That was especially helpful because we did have a restructure of our quality position, and so transitioning that role, the resources are incredibly helpful for our hospital. Quality assurance and performance improvement. And so as a hospital, we're always looking for performance improvement projects. And recently we've started antimicrobial or the antibiotic stewardship timeout note. And so we evaluate what antibiotics patients are on, look at their cultures at that 72-hour window so that we can either discontinue them quicker or change the medication or continue therapy. I think that for our community, it's very fortunate that we have a hospital like this here. We offer a lot of different services, especially for being a small town. We have a pretty robust outpatient department and imaging and clinic. We have skilled providers that are able to provide the care needed and inpatient-wise. So I think our facility and staff are well equipped to take care of our community. Of course, we have referrals if we need to, if that is a service that we don't provide here, but at all possible, if we can provide it here, we are happy to. I just think it's important that we do keep a hospital in such a small community to provide those access points for the community and the surrounding areas, because rural health care is just that. You don't want our loved ones and community driving very far for the care they need.
That's like, yeah, the thing that I have trouble, I'm giving up. And now we're getting it here.
Okay.
Well, where you've been taught, you know. Yeah.
What do you think about the situation over there?
Over
You
where?
gonna getting along all right, or
Over where?
what?
Right now. It's for the grant. Quality improvement and antimicrobial stewardship and all of that.
Would you always like give the time and like the day and like kind of like a description of like
Disease area, that was from the second grant,
Correct.
and then the ultrasound was the first grant.